Have you noticed your erections just aren't as strong or reliable as they used to be? If you're over 65, you're definitely not alone. This affects 7 out of 10 men your age. Most guys think it's all about testosterone or blood flow. But here's a clinical fact most never hear. Your pelvic floor muscles are the real gatekeepers. These hidden muscles actually trap blood inside the penis, helping you stay firm. And just like any other muscle, if you don't train them, they weaken over time, especially after 60. Clinical fact. Studies show that men who do targeted pelvic floor exercises can see up to a 40% improvement in erection strength within just 12 weeks. That's why pelvic floor training is a total game changer. Kegels aren't just for women. I've seen men in their 50s, 60s, and even late 70s make dramatic improvements just by working this overlooked muscle group. One of my patients, Robert, age 68, told me, "Dr. Morgan, I wish I'd known about these exercises a decade ago. They gave me back my confidence. Today, I'll walk you through 5 of the best pelvic floor exercises you can do at home. No equipment needed. These will help you build firmer erections, better control, and support your bladder health. Something every man over 65 should care about." Quick question. Have you ever tried pelvic floor exercises before? Drop a comment below. Your experience could really help other men in our community. Stick around to the end, because the final move is the one most men skip, and it's the real secret to lasting firmness. Let's kick off with the first exercise, the pelvic tilt. This is especially effective and safe for men over 65, even if you haven't exercised in years. Lie flat on your back, knees bent at about 45 degrees, feet hip-width apart. Keep your arms by your sides, palms down, so you feel relaxed and stable. Safety tip. If you have lower back discomfort, slide a small pillow or rolled towel under your knees for extra support. Take a deep breath and let your body settle. Now, gently tighten your abdominal muscles as if you're pulling your belly button toward your spine. At the same time, press your lower back into the floor, closing any gap. As you do this, tilt your pelvis slightly upward. You should feel your lower abs and pelvic floor muscles engaging, but don't force or strain. Hold this position for 3 to 5 seconds, breathing steadily through your nose. Then, slowly release back to the starting position with control. It might look simple, but inside your body, this move is a powerhouse for sexual health. Research shows that pelvic tilts activate the same deep pelvic muscles, responsible for trapping blood in the penis during erections. When these muscles are strong, you get better blood retention and firmer results. I always tell my patients, think of pelvic tilts as the foundation, like push-ups, but for your sexual health. Start with 8 to 10 reps, focusing on quality over quantity. And don't worry if it feels a bit awkward at first. That's perfectly normal, especially if you've never trained these muscles before. Ready for the next exercise? Let me know if you have any questions or if you already feel a difference after trying this move. Next up is the prone stretch, a move I recommend to almost every man over 65 who wants better blood flow and firmer erections, but also needs to protect his lower back. Start by lying face down on a comfortable mat or carpet. Extend your legs straight behind you. Place your elbows directly under your shoulders, forearms flat and parallel, as if you're easing into a gentle cobra pose. This position is easy on the joints and accessible for most fitness levels. Lift your chest slightly off the floor, keeping your neck in a neutral position. Look straight ahead or slightly down to avoid straining your neck. Now gently engage your core by drawing your belly button inward. Imagine you're trying to lift it away from the mat. At the same time, lightly contract your pelvic floor muscles, like you're stopping the flow of urine midstream. Why this matters? Even though it looks simple, this stretch is a powerhouse for men's health. It opens up tight hip flexors, which get stiff from years of sitting, while also activating the deep stabilizing muscles, the pelvic floor, lower abs, and transverse abdominis, all at once. Clinical fact. Studies show that combining stretch and contraction like this improves both muscle endurance and nerve signaling to the pelvic region. That means stronger erections and faster response time when you need it most. Most men who practice this regularly notice less lower back tension, improved posture, and a much stronger awareness of their pelvic muscles during intimacy. That mind-muscle connection is key for better performance and confidence. How to do it? Hold this stretch for 20 to 30 seconds at first, breathing steadily. Repeat 3 to 4 times, resting 10 to 15 seconds between each hold. As you get stronger, Increase your hold time to 45 seconds or even a full minute. Over time, you'll feel your pelvic region becoming both looser and stronger, the ideal combo for lasting firmness and healthy blood flow. Quick check-in. If you feel any discomfort in your lower back, adjust your elbow position or place a small pillow under your hips for support. Your safety always comes first. Ready to try the next move? The third exercise is the kneeling ab draw-in, a favorite for men over 65 who want to boost pelvic control and core strength without stressing their joints. Start on all fours in a tabletop position, hands under shoulders, fingers spread wide for stability, knees under hips. Keep your spine in a neutral straight line, not arched or sagging. Take a slow exhale through your mouth. As you breathe out, gently pull your belly button in toward your spine, flattening your stomach. Don't tense your shoulders or hold your breath. At the same time, lightly contract your pelvic floor muscles. Imagine you're stopping urine midstream or gently lifting your pelvic area upward. Hold this contraction for 3 to 5 seconds, breathing smoothly. Then slowly release back to the starting position. Why this works? Even though the movement is subtle, inside your body it's powerful. You're activating the deep core, especially the transverse abdominis, which acts like a natural corset, while teaching your pelvic floor to coordinate with your breath. Clinical evidence. Research shows that combining core and pelvic floor activation improves pelvic stability, increases blood flow, and strengthens the nerve pathways between your brain and sexual organs. That means better control, more endurance, and improved performance during intimacy. Men who practice this regularly often say they discover new muscle control, suddenly able to feel and manage areas they never noticed before. This translates to longer-lasting firmness and the ability to delay climax when needed. How to do it? Start with 10 to 15 reps, moving slowly and focusing on precision over speed. As you build strength, increase your holds to 5 to 10 seconds. For added challenge, gently shift your weight forward or back to engage more muscle fibers. Pro tip: quality beats quantity. If you're unsure you're doing it right, place your hand on your lower belly. You should feel gentle tightening without straining your back or neck. Ready for the fourth move? The fourth move is the bridge abduction, a gold standard exercise for men over 65 who want to maximize pelvic blood flow and build a rock-solid foundation for sexual health. Lie on your back on a supportive surface, knees bent at 90 degrees, feet hip-width apart and planted firmly. Arms by your sides, palms down for stability. Safety note: if you have lower back issues, place a small pillow under your head or try the move on a firmer surface for extra support. Press your heels into the ground, squeeze your glutes, and lift your hips up until your body forms a straight line from shoulders to knees. This is your bridge. Once you're stable, gently push your knees outward as if you're trying to spread the floor apart beneath you. Hold this outward push for 2 to 3 seconds, then bring your knees back in with control, but keep your hips lifted the whole time. Why this move matters? This exercise fires up your pelvic floor, the muscles that trap blood in the penis for firmness. Your glutes, the strongest drivers of pelvic circulation, and your hip abductors, which stabilize your pelvis and further boost blood flow. It's a triple threat: strength, stability, and vascular health all in one. Clinical perspective. Research shows that men who regularly practice bridge abductions see improved erectile quality, less lower back pain, and better pelvic control. The coordinated muscle action acts like a natural pump, sending fresh, oxygen-rich blood exactly where you need it for stronger, longer-lasting erections. How to do it? Start with 8 to 10 reps, making each outward push slow and deliberate. Keep your hips up and abs engaged. Avoid letting your lower back arch. As you build strength, progress to 15 to 20 reps, or add a resistance band above your knees for more challenge. Men in my clinic often tell me this move gives them more confidence, not just in the bedroom, but in everyday life. Better posture, less hip pain, and a real sense of control over their body. Pro tip: if you feel any discomfort in your knees or lower back, check your form or reduce your range of motion. It should feel challenging, but never painful. If you're noticing firmer results or have questions about variations, drop a comment below. Your feedback helps the whole community. Ready for the final move? The rocking frog stretch is my top pick for men over 65 who want to unlock the pelvic region and reach the perfect mix of flexibility and strength for lasting sexual health. Start on all fours on a comfortable mat, hands under your shoulders, knees under your hips. Slowly slide your knees outward, turning your feet slightly out. Stop when you feel a deep but comfortable stretch through your inner thighs and groin. Never force the movement. Lower yourself onto your forearms, keeping your spine neutral and your head relaxed. You should feel a strong opening across your hips and pelvic area. Once you're stable, gently rock your hips forward and backward in a slow, wave-like motion, syncing with your breath. Why this move is a game changer. Dual action. This stretch releases tight adductor muscles, inner thighs, and loosens up the pelvic floor, both of which often get stiff from years of sitting or stress. Tightness here can literally restrict blood flow to the penis. Clinical insight. Studies show that men with balanced pelvic floor tone, not too tight, not too loose, have significantly better erectile function and control. The rocking motion boosts circulation, improves lymphatic drainage, and helps your pelvic floor learn to contract and relax in harmony. The Goldilocks zone. Too much pelvic tension reduces blood flow and can lead to early release. Too little tone makes it tough to stay firm. This stretch helps you find that just right balance for peak performance. How to do it. Hold 30 to 40 seconds, rocking gently with your breath. Rest 20 seconds between sets. Repeat 2 to 3 times. Modify. If too intense, narrow your knees or place a pillow under your chest for support. Safety tip. If you have knee issues, use a thick mat or reduce your range of motion. You should feel a deep, good stretch, never sharp pain. Men in my clinic often call this a game changer. Better blood flow, more reliable erections, even more satisfying orgasms. It's the perfect finishing move, combining release, flexibility, and control. Ready to put all 5 moves together? Let me know how your body feels after this stretch, or if you want a recap of the full routine. Your feedback helps other men in the community take control of their health. There you have it. 5 clinically proven exercises that I've used with thousands of men in my 15+ years as a board-certified urologist. These aren't quick fixes or internet gimmicks. They're science-backed moves that retrain your body to circulate blood efficiently, strengthen the exact muscles that keep you firm, and give you real control where it counts. The real secret? Consistency, not intensity. Just 5 to 10 minutes a day can produce noticeable improvements in as little as 2 to 3 weeks, with dramatic results after a few months. Think of it like taking your daily medications, a small daily habit that pays off for years. Bonus? These moves don't just help in the bedroom. They also boost bladder control, reduce pelvic and lower back tension, and give you a real sense of confidence in how your body feels and responds. Gentlemen, at 65+, you're not too old. You're experienced enough to know what works. Stay consistent, stay patient, and you might be surprised at how much younger, stronger, and more energized you feel. If this video helped you reclaim your health, share it with a friend who could benefit, and subscribe for more clear, clinical, stigma-free men's health solutions from a practicing urologist. This is Dr. Rachel Morgan. See you in the next one.